wonderful educational program that we're excited to be able to offer. And I would love to introduce Andrew Dillman. He is the senior advisor with Core Benefits Group here in New Hampshire. And he's been in the insurance industry for over 40 years. And would like to talk to us tonight about Medicare coverage, the different plans that are available, and eligibility. So without further ado, I will pass it off to Andy.
So before we get started, let's go around the room and just mention your name and where you're from. So I'll start. My name's Andy Dillman, and I'm from Hudson, New Hampshire.
I'm Cheryl Gagney. I'm from New Boston, New Hampshire.
Okay.
And I'm Barbara from Goffstown.
Mm-hmm.
Kim Koyunjan from Goffstown.
From Goffstown, okay. So you had to drive up the hill or drive down the hill?
No, I actually live that way.
Oh, okay.
So.
Good. Well, thank you very much. We'll start at the beginning then. We'll start with Lyndon B. Johnson, 1965. He was the one that signed the Medicare into law. It was actually an amendment to the Social Security Act. So Medicare is just this little amendment thingy. So there are really two parts to the Medicare basics. There's hospital, which is Part A. Hospital meaning going in at night for hospital, but it also means rehab facilities, skilled nursing facilities, and hospice benefits. So that's Part A. Part A is free as long as you've been paying into payroll taxes for at least 10 years. So you or your spouse have paid payroll taxes for 10 years, you get Part A free. Part B, outpatient services. So outpatient services like doctor's visits, x-ray and lab, PT, physical therapy, OT, that type of thing are outpatient. Now, outpatient is $174.70 per month. Now, if you have higher income, you'll even pay more. So that's what Part B is. There's a deductible to Part A, $1,632. And there are also other little features to the plan that make it so that you have to jimmy around and get the laws. Yes?
Quick question. On the deductible, that's an annual deductible, I would imagine?
Yes, thank you.
Okay, and then on the outpatient, so you said on the outpatient, the cost is driven by your income?
It's $174.70. Right. And then if you're earning more than $103,000 and $203 for if it's a husband and wife, and it's graded up. And it's an interesting formula to figure out what your income is, and it's not what you find on a tax return. So it's fairly sophisticated, but suffice it to say that it's $174.70. And if you're in the higher income brackets, you will pay more.
Did they set the rate for the upcoming year yet?
Great question. No, that's coming up soon. And there are a few other things that are coming up soon. And some of them I can't tell you, even though I know. It's really, don't want to let the cows and horses out of the barn before October 1st, because October 15th is the date that you have for your annual election period. Okay, does that answer your question?
Yes, I have to wait.
Okay.
To find out if they're going to raise it. That was my question. Okay. I'm sure they'll raise it.
Thank you. I suspect $180 per month would be the maximum. But you have my business card there, and if it's much more, then you can call me and say it's all my fault. So that's Part A and Part B. But outpatient services, it's covered at 80% for the government would pay 80% and you'd pay 20%. It's not bad if it's a doctor's visit. But if you have a knee arthroscopic surgery for $15,000 and you have to pay 20%, that's going to sting. That's $3,000. You have a heart attack, you have a stroke, you're going to be paying even more. Okay? Now, if you get chemotherapy, you get radiation, it can keep going and going and going and never stop. So that's incomplete insurance. Government recognized that as things got more expensive, and so have two types of supplemental or private insurance. Both of them are good. They're a little bit different. Option one is MedSup, Medicare Supplement, also called Medigap. Okay, have any of you heard that term? Okay. So it pays the deductibles and co-insurances that were missing in Part A and B. The deductible $1,600 and the different 80-20 levels. So it's covering those gaps.
It says prescription at the bottom, so I would imagine it's what you just said and prescriptions as well,
Yes.
in addition to what you just were saying.
Correct. And we'll address that here and on another slide, prescription drugs changing. Okay. It does not pay for Part B deductible, and Part B deductible is $240 calendar year deductible. The deductible is does not pay Part B deductible. Okay.
Yeah, hang on. I think we're confused. So you
you
said
have-
$240 deductible.
That's on the Part D.
B,
B.
yeah,
That's what
which is outpatient
Okay.
services.
Okay,
Yeah.
gotcha.
Part B. Okay,
But
sorry.
the-
Sorry.
Wait, no, so,
And that's
so
standard, the deductible 240?
I'm using that. There are several different plans. They're all standard plans on a Medicare supplement side. And most everyone that goes to MedSup plan or a Medigap plan does go to a Plan G, which has a $240 deductible. Don't ask too many questions.
wait, all right. So Medicare supplement is to supplement your Part A and B that they don't pay.
Correct.
Okay, as well as your prescriptions. But it
Let's,
doesn't.
let's leave prescriptions separate.
Okay, so
It's,
all
we're
right.
working on A
But
and B.
does it? But then you said it doesn't pay Part. So it basically covers the 20% that we have to cover out of Part
Right.
B.
Okay. Would it be okay? Please ask me questions, but when we get too into the weeds, we can answer that later. So, don't mean to disrespect.
No, that's
you at
all right.
Okay.
That's all right. No worries.
Medicare Sup pays the deductibles and co-insurance. Does not pay Part B deductible of $240 per calendar year. Now, a great feature about a Medicare supplement plan is that you can go to any doctor or hospital that you would like. So it becomes your decision and your physician's physician. So if you want to go to Cleveland Clinic, if you want to go to the Texas Heart Institute, you can. Certainly the Centers of Excellence in Boston. You can go there when you want, as long as that facility accepts Medicare. 98% of all facilities and doctors accept Medicare. So you've got top-notch coverage. Kim, you're questioning something. You're squinting your eyes.
Yeah, no, it's all right. Go
Okay,
ahead.
all
Go
right.
ahead.
I thought maybe it was
reserving my
worth
questions.
talking. There are no referrals, no continued stay review, anything like that. It's what you and your doctor feels the most appropriate care for you. It does not cover any, or it only covers medical bills. It does not cover any dental, vision, hearing, that type of thing. So just medical bills.
But it does include Part D, or it does not?
Now, Part D is prescription drugs.
Right, so the
D
Medicare
drugs.
supplement is a total, are these two different parts?
They are two different parts. And so Part D, you would have to purchase, which would be separate from the Medicare supplement policy.
Okay, because I see it's covered in the option
Yeah.
two. Got it.
So we have to pay for the Medicare supplement as one, and then Part D for prescription as
Right.
another line item.
Right.
And then if we want vision or whatever, we got to pay. Okay.
Correct, correct.
There are some Medicare supplement plans that do have like provisions for eye, vision, and dental.
Okay, we'll get to that. Yeah. So for a Medigap plan, you're going to pay the $174.70 per month for Part B. Then for the Medicare supplement plan, you're going to pay approximately $180 to $200, depending upon the plan that you choose. Then prescription drugs, you can buy some inexpensive prescription drugs, but you're looking probably at $50 to $80 per month for prescription drugs, and it's going up. And that's good, and it's going up. And so you're looking at $425 or more to have a med sup plan and prescription drugs.
That's
Okay?
per person.
Per person, per month. Very good. Yeah. Okay. So option 2 is called the Medicare Advantage. It's very good insurance. It is different insurance. It has very low premiums, sometimes even zero premium. It's more a pay-as-you-go system. So, for example, routine physicals and routine labs covered at 100%. But if you go to a doctor, it might be a $30 copay. You go to a specialist, $50, $60. There are many different plans. If you go to emergency room, $150. Might be waived if you're admitted. Now, if you go into a hospital, probably a copayment per day of around $500 to $750. Now, that caps it at 5 or 6 visits, so it maintains that. You'll also have to pay 20% for chemotherapy, durable medical equipment. So you add all those copays and coinsurances together, you may have to pay a maximum out-of-pocket per year of somewhere around $6,000 to say $10,000 a year. Okay? So it is pay as you go. If you're healthy, it's not very much money. Yes?
I'm sorry, I was writing while you were talking and trying to take all these notes. So you said for Medicare Advantage, the Part C, the deductible was $6,000 to $10,000 a year. Is that what?
The maximum out of pocket.
Maximum
so you
out of
take
pocket.
all
Okay,
those
thank you.
co-payments together.
Okay.
Maximum you'll ever have to pay.
Okay.
Okay.
Does that include Medicare supplement as well?
Nope, that's option 1.
Oh, okay.
Okay, and this is option 2. Okay. Did you have a question?
Yeah, and that co-payment is in addition to a premium?
Yes. Right. Very low premiums. Okay. Another great feature of Medicare Advantage plan, it covers dental, or it could cover dental. Some plans cover dental, vision, hearing. Most all of them cover a fitness program. Silver Sneakers, maybe you've heard of, very good fitness program all across the country. Over-the-counter medications. Sometimes it can even cover your grocery bills, $50 a month for grocery. It can also help you go to a doctor's visit or something like that. So it has some unique benefits. Yes?
Is it specific to the state that you live in, or can you go anywhere in the country or outside of the country?
Great question. It is specific to New Hampshire because you're a New Hampshire resident. And same with Medicare supplement, but you can go wherever, but you're signing up for it in New Hampshire. If you have an emergency, yes, that's going to be covered.
But what if you're out of state, then you're SOL?
No, if you're out of state, you better not be going. If you have, knee surgery, you just had knee surgery, you're going to be able to go if you're a physician and you feel comfortable going. But if you get into an accident or there's an emergency someplace, yeah, it's covered. And you would have to come back as soon as possible, medically possible, on the Medicare Advantage plan.
Okay, I'm trying to keep these straight.
Yep.
The supplement plan does not work that way, though. The supplement plan, like if you are out of state and you need something with your knee, Medicare, you just go, that's fine, because Medicare is national. Mm-hmm. And then the supplement would still cover that if I had like knee surgery in Florida or something.
Correct.
Got it.
Yep.
Okay, thank you.
Okay. Mm-hmm. You're catching on, trying to demystify it. Okay. Prescription drugs are oftentimes covered under a Medicare Advantage plan as well. It's more of a holistic approach to the healthcare. So they are starkly different, and the price of a Medicare Advantage can be as low as $174.70 that you have to pay for Part B. There are other plans that will cost more. You'll have better benefits. It's also network-based. So for an HMO, anyone been covered under an HMO or a PPO? HMO or PPO? Okay. So an HMO, so you got a good idea of network. So an HMO, you have to go through your primary care physician. Now PCP, yes, you shake your head and oh my gosh. Well, think of them as your family physician. They help you through the healthcare system and the different options that you have. More and more you're seeing hospital systems being the way in which you get your care. You get a primary care physician, and they have the list of urologists, oncologists, and all down the line. So that's an HMO. Not many people pick an HMO because of that restriction. You only can go to doctors in New Hampshire. And if you go someplace else, it's not covered. Okay. So that's why people buy a PPO, just like Kim has or had, is that you have in-network procedures. That's going to have lower copays, lower deductibles, lower out-of-pocket maximums. So that's still a network. If you stay in it, it's better coverage. You go outside the network, you're going to pay more. However, you're having that freedom similar to the Medicare supplement where you and your doctor can determine where you want to go. Okay, so that's the two different plans. Medicare supplement, great coverage, freedom, low on the administration. Medicare Advantage, low premium, additional benefits, but you're taking more of a risk health-wise. And we'll get into it a little bit more for the annual notice of change coming up. You do have to, look at yourself and understand and think about what might be your worst case scenario. Medicare supplement's pretty expensive. If you go to the Medicare Advantage maximum, okay, maybe it's, call it $3,000 more, $5,000 more. Are you willing to take that gamble? Now, most of the time, 90% of the time, people don't hit that maximum amount. But you can hit it the first year, you can hit it the second year. So it really does become, hey, how do I want to do this? What's most important for me? Because you go out on the street and you say, what should I choose, a Medicare supplement or a Medicare Advantage? You're going to get a different answer from everyone, okay? And your cousin is going to look at you and like you have 5 heads if you chose a supplement plan, or if you chose a Medicare Advantage. It really does become a very personal choice. And so having someone to help you go through that can be very important. Okay, so we talked about the prescription drug.
Can I just
Yes, Barbara.
say one thing? I am very blessed and I'm very grateful for my good health. So
Yes.
I just want to share with you that I am in good health and hopefully it'll stay that way. But the figure that you gave for the Medicare supplement plan, that was pretty high, I thought, because I've got a Medicare supplement plan, the high G deductible, for $50 a month.
Okay.
And my prescription is only $5.
Okay.
So I'm paying.
That is very good.
I'm paying $229 versus the $425 that you quoted.
Yeah, you keep a good supplement. That is expensive. I mean, that is very low. I haven't heard anything that low. So.
Yeah, so I just wanted to share there is a high deductible on the supplement side, and it doesn't get talked about very often.
Yeah, we have the same thing with our PPO. It's got a very high. deductible, but it costs
But-
less. But the thing is, a lot of times the HMOs and the PPOs get you in that if you look at it, the HMO will tell you, well, you're going to spend less. But every year when I look at the comparisons, if as he was stating, something catastrophic happens, your HMO out of pocket is like $6,000 more than the PPO out
Yeah,
of
but
pocket.
the high D deductible is only 2,000.
Well, that's not too bad then. But you know what I mean? You end up paying more, I have found. That's why we went to a PPO, because under the HMO, we were
Right.
paying
Yeah.
way more. We were paying more monthly, and then the out of
Interesting.
pocket ended up being
Yeah.
more.
Well, maybe we shouldn't get so fixated on money then. There's a lot of numbers going around and it is confusing. An important provision on the Medicare supplement and Medicare Advantage, and I heard you talking a little bit about that earlier, is the concept of guarantee issue. So when you are first signing up, when you're first eligible for Medicare, and you're signing up for a supplemental plan, either way you go, Medicare supplement, Medicare Advantage, you can choose that plan. However, if a couple years down the road you're on a Medicare Advantage plan and you say, hey, I want to go back to that Med Sup plan that I heard of, now you can be subject to medical underwriting. What does that mean? The insurance company can say, hey, geez, Andy, have you had cancer in the last 5 years? Have you had a heart attack? Have you had a stroke? And if I say yes, then they can say, well, no, thank you. You can try again, but you can always stay within the Medicare Advantage system. Does that make sense, Kim?
Yes.
Okay, good. All right. So what we'll look at is the new drug plan. So this is part of President Biden's approach, and it's helping the more vulnerable people. And one of the features is this new drug plan. Has anyone heard of the donut hole?
I have.
Okay. You got a smile on your face, good.
It's as confusing as everything else.
Okay, good. Well, this has done a couple of things. It has, well, we're skipping ahead a little bit, but it gets rid of the donut hole. There's a $590 deductible. Some plans will have a lower deductible, but they can have up to a $900 deductible in the initial phase. Okay, and then you'll have 25% until a maximum out-of-pocket of $2,000. So under that prescription Part D, it would be maximum out-of-pocket of $2,000. Right now, it could be $6,000 or more, depending upon the donut hole and the prescriptions you're taking and all. And then there's a catastrophic phase, which is 100%. So significantly better and easier. There's also a smoothing provision so that if you do have an expensive drug at the beginning of the year, you can say, hey, CVS, hey, Rite Aid, I have this prescription drug. I don't want to pay $2,000 for it. I want it to be spread out over the year. So there's some very good features to this new drug plan. What will then be happening is the other shoe's going to drop, right? It's going to be charged more. There'll be more expenses, typically. Also, the ways in which your drugs are covered. So you might have a preferred generic or a generic brand, a preferred brand, and specialty tiered. Very good, yep. And so that tiering, moving the drugs from different tiers up and down. So yeah, it's very important now to look at your deductibles and your drugs that are in the network. And so you can make sure that they're covered, and you can find out which pharmacies they're at and how much they're going to cost, and how much, if you take a 30, 60, or 90-day prescription. Okay. So it's very good. However, it is going to change things. And we'll quickly go into, how do you sign up for Medicare? When do you sign up? Okay, Cheryl, you're
Yes, I have to do, because it's 6 months before, 6 months after you turn 65, right?
yep, 3 months before you turn 65, the month that you turn 65, and 3 months after you turn 65. That's your window for your initial enrollment period when you're turning 65.
So it has to be during that when the enrollment starts in.
3 months before your birthday.
Yeah.
Right.
So, a quick question on my husband's still working, and we're over 65, so we're still on his insurance. We have signed up for Medicare Part A. We had to do that because of.
And it's
So
great.
what happens? So what are the rules for us signing up when he no longer works?
Okay,
We have a letter from his company stating, so that we can show Medicare that we have been legally covered by insurance
creditable
full
coverage.
time,
Yep.
blah blah. So we each have one of those. They send us one of those every year. But what do I do? What's the time frame between the time he's no longer employed and we have to sign up for Medicare Part B and the rest of it?
Ideally, you would want to sign up on the day, or so if, let's say you're retiring November 1st, you'd want to sign up sometime during September, and it'll be beginning or October, beginning of the following month. Okay, so it would be at the beginning of the following month. Yeah.
Okay.
Right. But there are different rules and there are different reasons, and you have up to 8 months after he retires to choose it. So there are many unique rules there, and maybe we can talk about it, Kim, if you'd like.
That was the question that made me think. So I'm on my husband, he's still working, and he won't be I'm 6 months, older than him. So you don't have to sign up unless his company refuses.
Right. You have, as long as you're
I still have to sign up for A, but I don't
right.
have the
You
rest
don't
of the
have to
insurance
sign
is-
up for B until as long as you're fully covered under his insurance, then you don't have to worry about it.
Okay.
Now,
But you do have to get a letter from his company stating that you're both fully covered under an insurance plan. Otherwise, I believe Medicare fines you. Is that not correct? You get a fine if you're not.
now you saw my eyes go.
Yeah, I know. There's a fine, and it's a lifetime fine, is it not?
There are several fines. If you don't sign up for prescription drugs on time, for every month you don't sign up, there's a 1% increase. And so if 2 years down the road you sign up, well, you've got a 24% increase to the basic price of prescription drugs, and somewhat similar for Part B, but that's 12% per year, and it continues. I'm sorry, I may have that wrong, but it's only on Tuesday that it happens. So,
Is your prescription plan through his work, or you?
Yeah, we're fully covered. We've got
Yeah, that's-
dental
'cause I was about to
vision,
say
the
that's
whole
what I have, all
thing.
that,
So I don't have to
so-
worry about that now. But
now
it's come.
it then becomes a question of, what you're paying for now and what you're getting compared to getting Medicare. So you can look at the plan, the network, the costs, and figure out which plan you want. So you have an option now. And then the real good thing about looking at your option is you're going to get used to what Medicare rules and procedures are going to be. So definitely look into it. Do the work. It's a pain in the neck. However, you're now going to be able to start demystifying this in practice. See one, do one, teach one. So that, we'll do it. This is how you can get on to Part A and B. You can go online. You can go to your local security. I think that's up in Concord or Manchester. Sorry, or you can give a call. So anytime you want, give them a call. Go down, bring a cup of coffee, a crossword puzzle, and
Or be on hold for a
And if you're I think I remember this. I think it's still true. If you are already getting Social Security, like if you started your Social Security at 62, you don't have to do anything because they're automatically, well, I shouldn't say you don't have to do anything, but they're going to automatically start taking it out of your Social Security payment. So you're like going to be automatically enrolled in the Part A and B. That's correct?
Pretty
then,
much so.
And then you
they're
just have
not
to choose
A and
about
B,
the other.
but if you are covered and you've taken 62, now you get 65, and you're choosing Medicare Part B, yes, that $174.70 will be coming out of your Social Security check.
Yeah.
Automatically, so you don't even have to sign
No,
up.
you don't.
Right.
Yeah, my father-in-law worked that way
Right.
because I did his. So.
It's nice and easy, but you're still paying $174. You know.
Yeah, but you're paying that regardless,
Correct.
you're paying that regardless. Because even the Advantage plans, you pay that. Yeah.
But it just feels better not having to write out
Oh,
the
it
check.
totally feels better not to have it right out of check.
Good. So there's the annual enrollment period coming up, and it is every year, October 15th to December 7th. And during that period, you're going to get an ANOC letter, Annual Notice of Coverage. So at that point, Annual Notice of Change, excuse me. At that point, you'll get a letter, and it will detail what your current plan has now and where it's going for next year. You'll want to review your coverage, look at it and see how it's changing. You want to evaluate your health needs. Again, look at yourself, see how healthy you are, see what you need. Do you need more dental? Do you need more vision? Where is it? I don't know. But it's another time which you need to look at yourself, look at the health plans and the options that you have, and make a decision, because now it's yours. It's your decision. It used to be your HR person would come out once a month, give you your booklet, and say, and the company rep come out and you talk and you say, nod your head and everything's good, and you go on. And so after 40 years, let's call it, you've got that in the rhythm. Now it's all on you. You're making the decisions.
So all of the different Medicare Advantage and Medicare supplement plans are on Medicare SSA Gov?
No. That's where you sign up. That's where. What, Cheryl?
Those are the ones you get bombarded with.
Oh, correct. They're the Joe Namath ones, yes. So that's the Social Security Administration is where you sign up for Part A and B.
Okay.
You can, the state has a list. It's probably not updated because of the coming change, but you can go to the state website and it lists all the supplement plans for every company and A, B, C, D, like all the alphabet numbers.
Gotcha.
And the premium amounts, which I have found are not 100% accurate, but they're close. But they're not, so you think you can find out more about the plan there, and you can't, if you click on it, then it like brings you to you're leaving the state site and
Right,
you're
right.
going to the
Private.
actual,
Right.
and then
Yeah.
they don't generally have a lot on those. They generally will have someone call
Yeah, it's
you.
just like an overview, and then if
Yeah.
you want the specifics, though, you've got to give them a lot
Yeah.
more information.
yeah.
And that's good. So information will go back both ways.
Right.
Yeah. Okay. And gather your documents. Again, this is, you got to get your Medicare card. Having your Medicare card, your red, white, and blue card, and all the numbers and dates, effective dates of coverage are important to make sure you have. Medication lists, quantity, number of days, 30-day, 90-day, very important this year. And list of doctors, especially your specialists that you're seeing for ongoing care. That you've got a knee arthroscopic surgery 2 years ago and you don't need to see.
Do you know if any of the plans pay for alternative health cares like acupuncture or chiropractor, musculoskeletal, osteopaths, that kind of thing?
Currently, no. There are some chiropractic benefits on some plans, so you would need to check that out. Yeah.
Okay.
I want to give the library a plug, since we're in the library.
Yes.
I was telling Cheryl that when I started this exploration a few years ago, there's a book called Medicare for Dummies.
Ooh.
And I actually came across it in an AARP magazine, like as a, here's a book you should maybe look at.
I might have seen
And
some.
our library at the time, we might have a copy now, but oh, we do? We do?
We do.
Okay, but I told Cheryl that
Another
I,
hand for the library.
I bought it, borrowed it probably at least 4 times over a 2-year period. And, I had sticky notes in it, and I had pages and pages of notes. I found it to be very helpful. And one of the things that I learned from the book, which on the Medicare.gov, it's not easy, but there is a way for you to put your drug in there, and then it does this whole pharmacy price comparison thing for you, so you can get several pulled up at the same time and look at it. But it's not 100% user friendly, but it's a good way before you choose to do that comparison thing.
That's very good. Also, if you work with a local trusted agent, they'll have that type of thing right at their desk, and they'll be able to look through whatever prescription drugs you have. And so that would be getting that list together and sitting down with someone, and it would be very easy, elbow to elbow with someone.
Yeah, but I just wanted to say that when I was first doing this, I talked to several people like yourself, and nobody told me about the Medicare, the Plan G, the high deductible Plan G. And then it was only when I found that for myself on the state website that I was able to circle back about it. So I think it's good to utilize multiple sources.
Absolutely, and going to Medicare for Dummies is good. Right.
Yeah, the current
All right.
edition. The current edition.
Obviously.
Yeah.
The Pfizer, I've heard from a friend of mine that this was that ServiceLink, Pfizer, ServiceLink was a good resource for information regarding different plans. Would that be your?
I know of it. It is a state-run agency that does do that, and it's an 800 number.
Well, that's one you talked about that you could click on. It gives you a list, but then you have to further contact.
Are there any
Yeah.
offices?
Yeah.
Do they have any offices, or is everything on online?
I've never been. I have called them multiple times and have used their stuff online.
Okay, good.
Yeah.
All right.
Asked some pretty good questions.
I wish you all luck. I'm telling you, it was a headache for me when I did it. But I went to multiple things like this and read a lot and certainly read the newspaper. I don't know if anybody reads the newspaper anymore.
I do.
But
Every Sunday.
yeah, there's been some good op-eds recently in the paper that I think people should pay attention to, written by doctors. And yeah, there's been
No,
a
our
lot
case,
of,
we're a little different because Kyle's covered them. Mark's insurance let us carry Kyle, even though he's over 26.
Oh, wow.
Yeah, because he's got,
yeah.
we petitioned.
Disability.
Yeah, we petitioned, and we have full guardianship of him. So he's still on our insurance. I have Medicaid for him, but they pay nothing. Literally.
Medicaid pays nothing?
Nothing. They don't cover anything he needs. So we pay out of pocket, and his meds are covered by my husband's insurance and his doctor's visits.
Because typically Medicare will have lower prescription drug copays, depending upon there are typically two levels under Medicaid in terms of LIS or dual.
It's just it's convoluted. So for now he's covered, but for us we've got to be.
Because Medicaid is usually very good. Medicaid's run by the state. Go to the state office and.
I have. They've asked me. They've told me that I needed to bring basically a tome of additional information that they've already got in order to cover any of his prescription medication.
Okay.
So until I have to face that fact, he's just being covered by our stuff. But so it becomes more complicated for us.
And you're shaking your head for?
Oh, just the whole bureaucracy. This stuff is just mind-boggling.
Yes, well, I'm thinking of actually going back to where I'm from and possibly get the better.
But in a positive note, I have asthma, and I was on one of the affordable care plans, and which had enormous deductibles.
Yes.
And they didn't cover going to a pulmonologist or a specialist. And so my PCP is managing my asthma, and not really, because he's not a pulmonologist. I was over the moon the minute that I got on Medicare, without calling my PCP, without prior authorization, without anything. Oh my God, I could finally have an appointment with a pulmonologist. And now I go every year to my pulmonologist, and it's so much better for my health.
Right.
So there's good things.
All right. Well, at least I needed to get information, and then I can figure out based on the information provided what other information.
Yeah.
And that's my question was like, well, my husband's still working,
Right, exactly.
At his company, so now that was good. Now I still register, but I have to get a letter. And
Yes, and do, because like I said, I found out that if you don't have any proof, it's not a pretty picture.
Right. And that's going to be more important on the prescription drugs, because prescription drugs under Part D, now coming up in 2025, will oftentimes be better than the insurance plan that are at some companies. So that's something else to look at, because it's non-creditable coverage if you don't have a plan that's at least as good as the standard prescription drug Part D. Does that make sense?
Yes.
Okay. Yeah. Right, but it may change. So there are new things like that, and so unbeknownst to you, you can 2 years from now, hey, geez, you have 2 years of penalty because you should have. And we're going to have to see that through, because that doesn't make sense, because it's no fault of most people's.
And the thing is, if you're on a fixed income, how are you supposed to cope with all these penalties and fees and all that stuff? I mean, for people, who are
Well, you just have to sign up when you're supposed to sign up. But
so
yeah.
the
people fall
prescription
through
plan
the
of
cracks.
his plan actually costs more than what a Part D plan that I would buy into. I get penalized.
You can, yeah. If your Part D is better than your employer plan, it's non-creditable and there can be penalties.
And the Part D is not through the government, though. That Part D I have to select out of private insurers, yes?
Yes, that's correct. It's regulated by the government.
How does one go about finding out if their prescription coverage is creditable or not?
Your human resource department, where you work, is supposed to every year.
Supposed to know that? Okay.
yeah,
Right.
they do.
Okay.
Yeah.
That's why we've
Ask
got.
them.
That's why we have.
I'm not the one going to the place, though. My husband is, so I can make sure he asks the questions.
Yeah, he just gives me HR's number and says, "Here,
Here, you call.
here's the basic information. You deal with it."
Okay, back row, you've been quiet and you haven't moved. Now you're relaxed.
First class.
This is mine too, so but they're very good information. You are too. I mean, between with all three, it's
Yeah, no, I
it's
mean,
good information.
Can I just share a little bit, since I have have been on it. So some things that happened to me, at least this might just be my personal hang up, but I feel like I was managed by fear. You know, that
Fear of the unknown.
well, just like you have to get this supplement and you have to get it now, because if you don't get it now, they're going to be able to deny you later.
So
you know?
the intimidation factor.
Yeah, and so I feel like I let myself get pushed into a much more expensive plan than I needed to, and yeah, so that was something. And the other thing also is it's super, super tempting to get attracted by zero premium, and we'll give you $400 for, shopping at CVS, and
Nothing's free.
I was like, oh my gosh, one plan offered to pay for sporting equipment, to
Right.
keep you healthy. Oh my God, I get new ski boots. Like, I was so excited. But you have to, as Andy said, make sure that you are picking the plan that is best for you and your health, and be careful, because the old adage, you don't get anything for nothing.
Right.
There's something to that.
So, but here's there's also that question of, great, I'm in good health right now, and so I could pick a plan that's whatever. But then we all age. We're not getting any younger, and we're certainly not going to get any better. So, locking us, when you said earlier that if we pick one plan, you're locked into that.
Yeah.
If you try and change because you've gotten sick, now you're subject to this, what was it called? Medical underwriting.
Yeah.
You take good notes.
But is that not a violation of the pre-existing conditions?
Good question. They cannot deny you. They cannot ask any questions about any pre-existing condition. As long as you have not had a break in service of coverage for more than 63 days. So if you take a couple of months and you don't have it, that's okay. But if you have more than 63 days between prior coverage to your new coverage.
He's talking about a gap in coverage. He's not talking about switching.
Yeah, that's what I was referring to there. Even with the switching, you said that they'll go back to the underwriters and can deny you coverage, but because you've had some, you've had a health issue, but it's not the same thing. That's it's essentially a pre-existing condition they're looking at.
Yeah, they for some reason when Medicare that's not a thing. Like, so when I did end up switching, and I was, again, I was nervous about, will they accept me? Because I have asthma and all that. And the application was going through fine. And, then, do you take any prescriptions? Yes, I have all these asthma medications. And there was like dead silence on the phone. It's like, oh no. I thought I would be denied it. And the guy said, well, you just have to wait and see. And, it went through, but it's,
probably dependent on what your condition is. What I mean? Like, probably if you're taking a med that costs $10,000 a month, like some do, then they're going to have a problem with that. But,
and it depends on the company. Some companies are stricter than others. And when you go to the state website, if I remember correctly, there's a little asterisk or something. Some of them say that they don't have that provision, that they're not going to.
They'll always guarantee you.
They'll always guarantee you.
Gotcha.
So there are companies that, I don't know anything about them, but just so you know.
And you can't lie.
Right.
Because they have a database of information, Medical Information Bureau, that can track. And so, do be honest on it.
But I have an article from the New York Times where, again, fear, it scares you, where somebody would, just like what you were saying, you're healthy, you think I'm fine or whatever, and they chose, they wanted the gym benefit and all that kind of stuff. Right. And then he got cancer and required chemotherapy and everything. And so when he tried to switch back to Medicare, because he wasn't able to go to the doctors he wanted to go to, he wasn't able to get a supplement plan.
Because of the
he had-
underwriting.
Because, right, and so
The
he ended up
underwriting
having
issue.
a huge expense, so
Right.
it's,
Yeah, there's a lot of fear that you can look at, and it's real. And there's a lot of, get the free bike, Peloton bike, or whatever. So there's both sides of that. So it is not a brave new world. It's a scary new world because it's all on you, and you have to make the decisions. You're going to have to suffer with the consequences. So doing what you're doing is great. And at some point you do have to make a decision and go confident in that way.
Another thing too, when I was shopping for supplement plans and I was trying to dig into the companies themselves, someone like yourself is very helpful because I talked to someone who, was in a role like you are, and they were able to say to me, "Oh, that premium is low because they're trying to get into New Hampshire. They're just entering the market, so they're
Yes.
And then that
So it's
person,
an introductory rate.
yeah, and then,
Right.
and if the average person wouldn't know that, they'd say, "Oh, that looks good to me."
Or why is it so low? But that's a reason.
Right.
Yeah,
You're
and
trying to
then-
break into the market.
Yeah, and then the person who was able to say
Exactly.
to me also, when I asked about another company, they were saying, they have had a good history of increases.
Right.
I think this other company is more
Right.
stable in their premiums and stuff. So
Yes. And there's actually star ratings for the different plans that'll give a star for how their claim processing is in administration, and then there's overall star rating as well.
It's so
So
anxiety
you can ask
inducing.
it's very
Yes,
anxiety.
it should be on a lot of the
Just to
different
take a-
literature
just to
that you
sign
can
up.
get.
Exactly. Exactly. I agree with you 100%.
I mean, really,
Yeah.
need,
And
Prozac, just
this
like
has nothing to do.
No, you can only have the generic of it. The Prozac's not covered. It's only the generic.
This has nothing to do with Medicare supplement, Medicare Advantage, traditional Medicare, whatever. I'm sure you've all heard about how Medicare is negotiating the prices,
Yes.
right?
Right.
So how wonderful is that? So only 10 drugs or whatever. But then Bernie Sanders and some other people, they negotiated for insulin
Yes, they did.
regardless,
Yeah.
and then they did asthma drugs, and it was like in February or March they announced that $35 cap for inhalers when people were paying which I'm paying $286. So and it went into effect June 1st. I waited and went to the pharmacy June 1st to fill my prescription, and they said it's $286, and I'm like, no. There's a newspaper story. It's $35, and they're
not
like,
till next year.
no. They're like, Medicare can't negotiate prices except for those,
10,
certain those
right.
10.
Right.
So you under 65 could go buy my medicine for $35, and I'm paying $286 for the same inhaler. And but I thought about that. It's crazy.
It is crazy, and I've been in the business a long time, and sometimes I get really jaundiced about it, and there is this shell game going on, and it is confusing, and it is, why can the next person get that inhaler for $5 and I have to pay $268? It's somewhat like being on an airplane in terms of the person next to you might have it for $200 and you have to pay $300.
It's just in your supplemental. My father-in-law used to gripe, crikey, every bloody month. The man paid $988 a year for insurance that covered everything.
Wow.
The $250 deductible. And he moaned and groaned every ruddy month, every quarter when those bills came in. And I just said to him, you have no idea how ruddy lucky you are.
Well, and they stopped doing a lot of those. Because my father is, he's there. Yeah, good thing I have good supplemental plan, because he goes, they stopped.
They don't do
They don't
those
offer
things.
it
I mean, he had
anymore.
two
Right.
heart
But
attacks.
he had bought it into
Right.
it when it
He had
was.
two
and
heart
so-
attacks, and I think it cost him all of $400 and some odd dollars out of pocket. I mean, it was just.
It's a heart attack party.
I'm like, bloody well you're gonna pay it. I mean, talk about stingy, but you know what I mean? But really, I mean, these insurances have dissolved. I mean, nobody gets that kind of a.
No, they don't
You
sell
know,
them
his
anymore.
wife worked for an insurance company, and that's why he got it. But you know
Not
what
the
I mean?
best there was at that time.
It really is. It is anxiety inducing.
Now, Barbara, back to your point, talking about companies coming in with the low rate and everything like that. There is a new company coming to New Hampshire, and I can say it's WellSense, and they've done some Medicaid work, and so they have good relationships with hospitals, and they're coming to New Hampshire, and they're trying to do a really good job. Are they going to increase the rates next year? Well, they do. Then you go to Anthem, then you go to Aetna, then you go to United Healthcare.
Yeah, except you're subject to the underwriting.
Only if you want to go from the Medicare Advantage over to the Medicare
As
Supplement.
long as you're staying supplement, you're not.
Or
No, if you
Medicare.
switch supplement, you're still
Okay.
subject to underwriting when you switch supplement plans, because that's what I just did.
Oh, so you're on a supplement,
Yeah,
and you had to.
I
Okay,
had
and you were
medical-
subject
Oh, and
to
you were
underwriting.
staying in the supplement.
Yeah.
Yes,
So even
okay,
if
I'm
you're
sorry.
staying in
I-
the supplement,
you still have underwriting.
so
Yes.
it's only on the Medicare Advantage that you don't have underwriting.
Correct.
But if you tried to go from Medicare Advantage back
Then,
to
yeah, then
Medicare,
you've
then you
got-
have
So
underwriting.
I have to
You can kind of stay in your
Medicare,
silos.
not
And the
applicable.
other thing that doesn't seem fair to the consumer is that, I mean, this isn't anything you can do anything about, but I just have to whine. That,
There's a wine party afterwards.
when we look at, the first thing they tell you, especially like say for Part D prescription drugs, right? Put in your drug, find out what tier it's under, what's covered. We can't change that during the year, but the drug companies can. They can drop their drugs anytime they want.
They do.
They can drop their doctors anytime they want.
Yeah, doctors less so in terms of the networks, but yes, on prescription drugs.
Prescription, those what do they call them? Those ruddy middle management people. I can't think of them.
Pharmacy benefit managers.
Yeah, that's it. Or
Right,
I
very good.
hate that name. Crikey, do I hate that name?
He's got weasels.
But they, but they do. They change. I mean, even if you're not on Medicare, because my son's meds haven't changed for 5-6 years, but the tiers that his meds are in, for some reason, change. So, like one of his meds has been on the market for, I actually looked it up, 1961, and the cost is going up it goes up like every 6 months.
Wow. No.
It is ridiculous. They just they change it from tier this to tier that. I like qui va bien, as we'd say, but I mean it's just ridiculous. And that's what I'm concerned with is in this scenario where you are locked in and you don't have a choice. If they just willy-nilly change the tiers, what are you supposed to do?
Wait until the annual election.
Yeah, you're kind of
So you're
screwed
stuck for
yeah.
the year.
Do you have any comment on the news coverage about several major companies in Medicare Advantage overbilling the Medicare and the I don't know if it's the IRS or the Treasury or somebody is going after them. That kind of really colors my thinking about those companies.
Yes. And show me the money, follow the money. And yes, there's always that, unfortunately. There is a program that's just in New Hampshire or in New England. And 2 years ago, they got a $212 million fine. So it's the big companies and it's the small companies. Unfortunately, it's a very regulated market in many ways. However, there are always loopholes and ways in which people find ways, and I don't know why or how. Don't get me on my negative soapbox. Yeah, capitalism soapbox. Yeah.
Yeah, I mean, they can come up with anything. I mean, I was just talking to Gail yesterday. She said she went to her doctor. She's for her hip thing. And the nurse said, "Oh, you're here for your glaucoma and blah, blah, blah." And she said, "I don't have glaucoma." And she said, "Yes, you do. It says there in my thing." So when she saw the doctor, she said to him, "I guess I'm going to have to sue you because you're not treating my glaucoma." And blah, blah. And he said, "What are you talking about?" She said, "Well, the nurse said that I'm here for my..." He said, "No, you're not. You're here for your hip." She said, "Well, what's the glaucoma thing?" "Well, we have to bill. We have to put extra charges on our bill."
That's illegal. They can't be doing
They
that.
are doing it.
Well, she should turn the doctor in.
So she went there so they're going to bill Medicare for a glaucoma or whatever.
They can't do
a
that.
checkup on her glaucoma.
They need
which
to.
she
She
doesn't
needs to
have.
report that. That's not right.
And she said,
And that is going to end up on
We
all
all
of
pay
us.
for
That's
that.
right.
Yeah.
That can't be allowed.
There is that shell game, and
but it is happening.
yeah, and there are situations where it's happened much to the better for the consumer too, because it's a imperfect system. It really is, and so many things are changing. There's so many things that can be done, so many things that can be, cured, and it's only going to get better from that perspective, but it's not at all perfect. It
But it's
is.
also subject to political whim, is it not?
Oh yes.
And that's the other issue that we've got, is all of this is subject to political whim. I mean, if they decide that, that whoever comes in and decides, well, that's it. We have no choice.
Well, then we'll move to the Netherlands.
That's all driven by lobbyists and lobbying, the large companies lobbying.
Yeah.
Right.
In the world, so.
But follow the money.
Yeah.
Right.
Yeah, it's always fun. Well, but this has been very informative, and I do appreciate your
Good.
spending the time with us and answering our questions.
I do too.
Thank you.
You may get a couple of calls
Well, good. Yeah.
to further clarify some issues,
Yes.
but it has been informative. Like I said, my husband refused. Actually, I want nothing to do with that.
That's how I felt.
Thank
And
you very
I have
much,
nobody
Annie.
to.
Yes, thank you very much for your time.
Thank you, everyone.
I had to do it.
Thank you.